requirements. As you dig deeper, you can select the agency's name on the website, and it's going to take you to some really good quality information that will help you make your introductory call. So, for example, when clicking on Angels of Care Home Health in West Texas, I was able to find data on how they manage their daily activities, managing pain and treating symptoms, treating wounds and preventing pressure sores, preventing harm, and preventing unplanned hospital care. Taking this information and looking at it closely, you notice that they'll give you a rating for the organization that you are looking at. In this case, under how often patients got better at walking or moving around, they got a 43%, whereas the average for the state of Texas is 53%, and the national average is 56%. So how would I use that information to tailor a quality introductory call? Well, in this instance, I may contact the decision maker, introduce myself, of course, as Snelly Medical Staffing, but I would like to take a moment and talk with you about your recent ratings on the Medicare.gov's website. I noticed that you are at a 43% with patients getting better at walking or moving, whereas the state and national averages are over 53%. I would like to sit and meet with you for 10 to 15 minutes to talk to you about how, by utilizing our services to handle your staffing concerns, we can find you with candidates who not only have the behavioral skills to match your organization, but also the skill set within their modality to help you find improvements in these areas and increase your overall Medicare ranking. Please, if you will, let's meet for 10 minutes on Thursday at 2 o'clock. So you can see I can use this information and tailor an introduction by just pointing out how maybe by utilizing our services we can help them find improvements with this data. Why is it important for home health organizations to have good rankings when it comes to the Medicare.gov website? Well, for one, most of their patients have access to this information as well, and they can make their decisions on who they want to utilize for this service based on these recommendations. So it would be important to me as a home health organization owner to increase my rankings in all of these areas so that I can increase my ability to acquire more patients. Additionally, their Medicare reimbursements are tied very closely to their success or failure at meeting these minimum expectations. And if their overall ranking falls below a specific number, they could be removed from this list and no longer be a Medicare-approved home health organization, which could wind up costing them time and money. So again, these are very important topics and very useful topics for us to begin or initiate our conversation with these decision makers. Lastly, our list of nursing home organizations. On this list, and we've provided this to you in a PDF format, I suggest you go down one at a time and look at each one of these organizations. The information that they provide is their company name, their location, phone number, as well as rankings or ratings. So we have an overall rating based on a stars of 5 out of 5 star ranking being the best, obviously 0 out of 5 being the worst. They take the overall rating out of other criteria that is also listed on this sheet. So we have home health inspections, nursing home staffing, quality measures. They also will let you know which programs they participate in, if it's Medicare and Medicaid, or Medicare only, or Medicaid only. They also will let you know the number of beds, which is very useful information because most states require a certain number of medical workers. So let's say, for example, nurses in Texas, they're required to have one nurse for up to 8 beds or 12 beds in some cases within their organization. So if I notice that they have 112 beds and divide that by 12, I get a pretty good idea of how many nurses they should have on staff. And then lastly, it lets us know the type of ownership. So let's talk about how to use this information to come up with better selling arguments or a better introduction to how you can get your foot in the door to get that first appointment. So I'm going to use this first example, Rockwood Manor. Under health inspection, they received a 2 out of 5 stars. Under nursing home staffing, they received a 3 out of 5 stars. So their overall rating was a 2 out of 5 stars with no information on quality measures. This does tell me that they are Medicare and Medicaid program participators. That also tells me that they have 112 beds and ownership is for-profit partnership. Knowing what I know with this little bit of data, for-profit organizations typically are more interested in cost-saving measures. So the first and most important aspect that I might want to tailor my pitch to when introducing myself to this customer is how we can present them with tools and resources that will help them lower their cost on the largest line of their profit and loss, or I'm sorry, their business plan, which is their human growth or human capital investment. So I might tailor my introduction on, I would love for you to have a chance to spend 10 to 15 minutes with me to talk about how your organization, through utilization of our programs and options, could save money by us finding you higher qualified candidates that are more retainable and likely to stay with your organization for the long haul at ultimately a cost reduction or savings to your organization. Would you be open to giving me 10 to 15 minutes? Well, I might make a few adjustments to that introduction because I have more information here that could be very useful. Knowing that they got 3 out of 5 stars on nursing home staffing, well then clearly that they are not getting the highest or best ranking on staffing that they could receive. And this information comes from the actual patients that live in this nursing home who do a survey on a quarterly basis that is then shipped off to the state, and the state takes that data to come up with these numbers. So it's important to me as an administrator of a nursing home to have a higher ranking in nursing home staffing because I want to have a better ranking on Medicare's website that ultimately will help me get enough patients to meet my 112 beds, which obviously will generate the revenue that we need as a for-profit organization to continue to grow. So I might tailor my introduction with, hi, my name is Gerrit Salinas with Snelling Medical Staffing. Wanted to take a moment. I noticed on Medicare.gov's website that your nursing home staffing received a 3 out of 5 stars. And I also noticed that you are currently working with 112 beds. I would like to take a moment to spend 10 to 15 minutes with you and to talk to you a little bit more about your organization and how you like to manage that organization. I would love to see if there's a chance that my organization would have tools and resources that can help you improve your overall nursing home staffing ranking on Medicare.gov's website while cutting costs or reducing expenses on your largest line item in your overall business plan, your human capital investment. Would you be willing to meet with me for 10 to 15 minutes on Thursday at 2 o'clock? Let's say that I wanted to tailor my pitch around health inspection. Well, I might change my pitch to say, I noticed on Medicare.gov's website that you got a 2 out of 5 stars when it comes to health inspection. I would like to meet with you 10 to 15 minutes to show you how through our use or your use of our staffing services, we can find you the talent that not only have the basic behavioral skills that you might be looking for as an employer and the skills within that successful or within that modality such as nursing, but I also could show you ways that we could find you the right people that would overall help you improve your health inspection ratings. Are you available to meet with me later this week for 10 to 15 minutes at 2 p.m.?